It
says there are 3 people in the waiting room. They could be, I don't know.
Good evening. We would like to call to order the September 18th meeting of the Community Service Committee of the City of Norwalk. I will do roll call. I see Councilperson Smith, Councilperson Burnett, Councilperson Sutton, Councilperson Dunn, and Councilperson Wiggins, who are all members of this committee. In addition, we have Councilperson Lopez, who is also joining us. At this time, I would like to make a motion to suspend the rules to add to this meeting's agenda the meeting minutes from April 19th. Can I have a second? I see Council Member Dunn. Thank you. Okay. Are there any persons in the queue for public comment? If you wish to make a public comment tonight on any of the agenda items, please raise your electronic hand so we can acknowledge you. Once you are acknowledged, please state your name and your address.
Just Madam Chair, just as a form of protocol, we had a motion to approve the minutes. We didn't call for the vote.
Oh, I'm sorry. Thank you. That's why he's here. All in favor to move the motion? Let me see your hand. 1, 2, 3. Okay, Mr. Wiggins. Yep, we have 4 for, any against? And are there any abstentions?
One abstention, Burnett.
No, Councilperson Burnett abstained. So the motion did pass. And now we call for any public comments. Does anyone have their hand raised? No.
Madam Chair, we have not received any emails, and I don't know who China May you is. Are you part of the presentation with Mid Fairfield? China?
That's the stenographer.
No, they're noted separately. Are you the same person?
This is Sharon Saltis. I'm with Telesco. No, my name is not China.
Ms. Mayhew, are you here to make a comment?
Yes, I am.
Okay, can you please state your name and your address, and you have 3 minutes to make your comment.
I was not listed for public comments.
Oh, you're not, okay, so you're just here to.
And in fact, I'm here with Telesco as well.
Oh, 2 for the price of 1. Okay. Okay. I'm gonna let y'all figure that on the back end. Is there anybody else here for public comment?
No, Madam Chair, no one else. Thank you.
Okay, we will proceed. We will close public comment at this time. We will now have the approval of the minutes from our April 17th meeting. Is there a motion? I see Councilperson Smith. Any corrections? Okay, all in favor, please raise your hand. 1, 2, 3, 4. Any opposed? Any abstentions? Councilperson Burnett and Councilperson Wiggins. Thank you. Now we will have the approval of the minutes of our July 17th meeting. All in favor, please raise your hand. Oh no, can I have a motion to accept those minutes? Councilperson Burnett. All in favor, raise your hand. Okay, 1, 2, 3, 4. Any opposed? Any abstentions? Councilperson Wiggins abstains. Thank you. We will now go on to item 4, which is a discussion. Chief Daniels.
Yes, good evening. Thank you, Madam Chair, and good evening, council members. Just in terms of quick updates, I'll be brief, but just wanted to share some highlights. It's been a while. We didn't meet in May and June, and just give you an overview of what's been going on here in community services. First, let me start with the Norwalk Mini Grant Program. The program has been a great way to support our local, smaller nonprofits working on projects that have a real impact in our community. In the last round that we just concluded, we received 26 applications with over 227,000 of requests. However, our budget was set at 100,000, and ultimately we were able to award 13 organizations with grants ranging from $3,600 to $10,000. And I know some of you were at the press conference where we highlighted those awardees. Secondly, just as more of an informational, especially I see Councilperson Barbara Smith and Greg Burnett. They've been here since I've been a Riot Chair, so I know you all been serving more than almost 6 years because that's when I got here. But I also wanted to make a note that we have received approval from an internal policy that the Community Services Department now has a new grant funding policy. And we've also updated our city's website. So whenever you're bored, you can look at our city's website under Community Services, and you will see the new Norwalk grant funding policy. I highlight this to let you know that that will be the policy moving forward in which we will fund organizations. And it just highlights for the community, both internally and externally, how we will make decisions in funding. While ARPA funding is coming to a close, we still have our mini grant and community impact grant funding, which that will be funding year out and year in. So we now have a policy, so we're all clear. We all have common language, and it's important to be transparent and fair and equitable. So that policy has been approved internally by legal. And so we're really excited that it's now there. So people are just not wondering how we do our process. And that was one of my goals of last year, that I can check off that the grant policy is now initiated. And then also lastly, we just want to share something with you that most folks know that I think maybe several years ago, there was this huge opioid settlement fund throughout the country. And Norwalk, we also received some funding. And so, because I will be back to this committee in the near future around how we can distribute that funding. But this is more of a prelude that we'll be meeting with key stakeholders soon to develop our collective strategy of how to use those funds to address urgent needs in our community. And we received a little bit over $150,000. And there's just very clear guidelines of how we use it. Norwalk has had its fair share of opioid deaths, and we're going to work with our chief and our providers who focus primarily on this particular population, so we can use those funds in an impactful way. So I'll be coming before you in the near future to release that funding as we do a contract with the mayor to support and provide some resources for that for opioids in our community. And then lastly, tomorrow, Mayor Rilling, along with myself and partners, will be announcing that you all approved back in July. And I want to thank you again, and I really do mean that. Our youth mental health gap analysis, we approve of funding. We already have the contract as you all approved, and we'll be announcing that tomorrow. So if you're not busy, I know everyone has other commitments. Tomorrow at 1 o'clock, we'll be in front of City Hall making that announcement of the youth mental health gap analysis study. It's not complete. The researcher now has been hired through Norwalk Partnership, and we'll talk about this wonderful partnership. And just highlight, it's a partnership with Norwalk Public Schools, our superintendent. We're very excited to be partnering with Silver Hills Hospital, Dr. Gerber, who really just wants to be a neighbor in our community and actually provided some funding we'll talk about. We're very, our strong partnerships both with Norwalk Community Health Center on Connecticut Avenue, of course, Norwalk Acts, that you're all very familiar with them. This analysis will help us better understand the barriers young people are facing when it comes to mental health, and help us identify as a community. The city is making this small minimal investment to lead the research, but it really is ownership of the community to focus on how do we close those gaps to ensure every young person has access to mental health services. And then lastly, in my closing, I just want to as I'm thinking, and I'm always thinking about the work we do, as we move forward, I think it's always important to remember that the work that we're doing isn't just about numbers or grants or policies. It's about people. It's about ensuring that our residents and our community have access to resources that they need, that our young people have the mental health support that they deserve, and that our nonprofits, those on the front lines, in the capacity that the city can help, have the tools to support our residents, because they're really the ones doing the heavy lifting day by day. And we can't forget that there are people in our community who are still struggling. While COVID is kind of beyond us, while there's some ebbs and flows, on a day-to-day basis, we still see our residents coming through our community resource hub who need help and need resources. And through Anna Vivian's leadership, through the community resource hub, we're connecting them to needed resources. And they're not looking for a handout, they're looking for a hand up. And we strive to make a commitment and do good in that. And so while we may be working with limited budget and resources, that doesn't diminish the impact we can have when we come together, focus on the needs of our community, and push forward with determination. So again, I just wanted to say thank you. It's been a while to this committee. This is usually where it starts, then move to Common Council. And look forward to that. We'll be sharing the press conference tomorrow around making good on a promise to support our young people, particularly in youth mental health. So that concludes my updates this evening, Madam Chair. Thank you so much. That's all for now.
Thank you, Chief. I would like to say on behalf of the Common Council, for you and your team, you have done it again. You have brought resources that we didn't even know we necessarily needed, or we may have acknowledged that we needed, but you have heard things that we have brought to your attention, and you have made sure you have connected the dots. And I have consistently said to everyone, the community service department is the people's department of the city, because we give so much resources. We make sure people are able to stay in the community and are successful in the community. So we just like to thank you and your entire team, all of the departments that you had, for a job well done. Also with the allocation of the opioid money that's coming through, and for the ARPA grant that has been decided. Moving right along, we have Mid-Fairfield Latinx Integrated Care Program presentation.
So I'm going to have Anna Vivian, our Human Services Director, kind of intro him and then let her take it from here. Thank you.
Thank you, Lamont. Good evening, everybody. So we're here to talk about Mid-Fairfield Latinx Integrated Care Program, which continues to provide mental health services to all students that are residents of Norwalk. If they're new arrivals and it's found that they have a clinical need, this is the team that's able to get a referral, receive the referral, and provide culturally sensitive programming that really engages the family as well as the student and the administration. So they've done a lot of work in conjunction with the school system to build that infrastructure so that the student has those wraparound services and supports. I won't steal all of their thunder because they did prepare some slides so that we can look at some numbers. And this isn't a new grant. So this is, Lamont, correct me, is third year.
That's right.
The third year, so they've done full presentations in the past, but we thought that it would be nice for them to do a little refresher. And like I said, provide you some of the numbers for this evening. Gail?
I'm here.
Hi, Gail.
Hi.
Lamont, do you need me to put up the slides or?
I can share them. I have them. Can people see me though? Or if I share my screen? I was going to talk first and then just show the slides after I said a few words, but I don't know if people will be able to see my screen or not, because I can't see me, so I don't know if you guys can see me or not.
We see your letter G. Are you trying to be seen?
Yeah, well, if you want to, yeah, that's fine with me.
I don't. So is your camera on? We just see a letter G.
So I don't have an option to turn my camera on.
Oh, okay.
It just asked me if I wanted to unmute, but I do not have.
Let me see. Do I control that?
You do. You have to bring her as a panelist, and her camera should then work.
Got it. Promote to panelists. Thank you.
Okay.
I'm promoting you. All
Okay.
right. Thank you, Madam Chair. We can see you.
Great, great. Hello, everyone. Thank you so much for giving me the chance to talk a little bit about the LINK program. I'll just give a little refresher. So my name is Gail Melanson. I'm the Executive Director of Mid-Fairfield Community Care Center right here in Norwalk on East Avenue. And for those of you who aren't familiar with Mid-Fairfield, we're a mental health agency that's been providing mental health services for the greater Norwalk area since 1956, believe it or not. So we've been around for a very long time. I haven't been there quite that long, but I've been there a while. We have outpatient services at our office locations at 100 East Avenue, and we also provide services in the community and in homes, and also currently support students in all of the Norwalk public schools between all our programs. The LINK program has been providing services to Norwalk children and families since 2020. And LINK was established from a request from the city to help our most vulnerable families with complex mental health and care coordination needs that were new to the Norwalk community. So that's kind of how we got started. LINK provides trauma-informed and culturally sensitive clinical treatment by bilingual, bicultural master's level therapists that are all trained in evidence-based trauma practices. The clinical team, so there's a clinical team and a care coordination team. The clinical team provides individual and family therapy, parent guidance, and facilitates trauma groups. The team also provides support and consultation to school staff, the teachers, the guidance counselors, social workers, to help them better understand and support the needs of the students. Care coordination is provided to families to help them access the existing resources that are available to children and families in the greater Norwalk area. And as other people have mentioned, Norwalk is very rich in resources, so we're trying to just connect them with services that already exist. They've been instrumental in helping families get the support they need, apply for benefits that they're eligible for, and help them to identify a support system for their family. The LINK program is a collective effort that is not only supported by the city of Norwalk, but is funded by private philanthropy, other grants, and we also have started to collect patient fees for families that have been found eligible for Medicaid insurance. Although there have been budget cuts to this program from the city, we've been able to maintain the same level of service due to our ability to secure these additional funding sources. Over the last few years, it's become more challenging to recruit and retain bilingual, bicultural staff due to the competitive salaries offered by private providers. But we have made it a priority as it is needed in the community, and without our services, many families would have nowhere else to go. So we've really made a conscious effort to try to be competitive. It's become more and more difficult to recruit, but we have lots of strategies, and so we've been very successful, and we've been able to get a solid team providing these services. The need continues to be very high, and cutting any services would leave many families without the support they need. It would also be a challenge for the city and school system to support these students without these valuable resources. And Mid-Fairfield continues, as always, to explore additional funding sources to bring in resources for this population. So if it's okay, I will share my screen and just go over some data.
Yes, please.
Okay. Oh, did I not share? Hang on, let me go back. Can you guys see it, or did I not press share? Share. Okay, there we go. Okay, can everyone see that?
Yes.
Okay, great. So these are just some statistics on the services we've been providing. So we've had 153 open cases for the fiscal year 24. Clinical cases, so as I mentioned, we provide clinical support and care coordination. So we had 94 families receiving clinical care, 56 receiving care coordination, and 3 receiving psychiatric care. We had 75 new referrals this fiscal year, 25 from the high schools, 37 from the middle schools, 12 from the elementary schools, and 1 was an internal referral from one of our other programs. Over to the right here, it looks at the scheduled versus kept sessions. And just to give you guys a reference point, the the goal is to get around 65%. Some of our other programs, maybe they reach 70%. So these numbers are extraordinary, that the families that the Link team is serving are coming for their sessions, they're needing the sessions, and most importantly, our staff are successfully engaging them. So individual sessions, 85%, family sessions, 82%, parent, 93%, as you can see. Case management sessions, 99% are attending those sessions that are scheduled. So as you look across, it's just really good show rates, and it really shows that the population is engaged and coming and benefiting from the services. Well, the next one will show how they're benefiting. I'll go to the next slide. So the first column is 96% youth satisfaction survey. So after a family finishes with their services with us, we give the parents a satisfaction survey to see if they were satisfied with the intervention services. And this, we just looked at clinical services is what I'm reporting out on right now. So 96% of our families either agreed or strongly agreed overall with the satisfaction of the services they received. They agreed or strongly agreed that services improved their child's functioning, felt the team were sensitive to their cultural ethnic background, treated the family with respect, spoke in a way that they understood. So those are just some examples of some of the questions that were asked. Next column is Ohio problem severity. So when we start working with a client, we assess their symptoms. And those that have scored in the clinical range, we assess everyone at time 1, which is when they first start services, and then when they complete services. So 100% of those individuals that scored in the clinical range, what we call the clinical range, showed improvement from intake to discharge. The next one looks at functioning. So let me just make sure. Yep. So that looks at how is an individual doing at the time of intake compared to discharge. So 77% of the clients showed at least a 5-point improvement in their functioning from when they started treatment to when they discharged. And then the last one is looks at overall client improvement, and this is based on a CGI scale, which is the Clinical Global Impression Scale, and that's completed by the therapist looking at the individual's functioning and symptoms when they first start treatment and when they discharge. And 82% of the clients that were assessed showed an improvement from intake until when they were discharged. Any questions? I'm just going to stop sharing my screen so I can see all of you again.
I do have a question.
Sure.
Oh, hold on. I will hold my question. Councilperson Wiggins, I see your hand raised.
Thank you, Nicole. I had a question really quick. So is this program, I'm not too familiar with Mid-Fairfield. Are they offering free mental health services for families and children?
Yes.
So is it 100% free, or is it a scale? Or what do you guys go by?
So there is no out-of-pocket cost to the family. If the family has Medicaid insurance, we will bill Medicaid insurance, but the family does not have any out-of-pocket costs to them. And if they don't have any insurance, then it's covered through the funding that we talked about earlier.
Thank you.
You're welcome.
My question was just in layman's terms, if you could elaborate just very shortly between the differences between clinical care coordination and psychiatric, just so that the community has a clear picture.
Absolutely. So the clinical services are the individual therapy, family therapy. It's the more traditional therapy you think about. So it could be individual, family, or we run groups, or it could be what we call parent guidance, where you're just meeting with the parent to, talk about some strategies for managing their child. Care coordination is the clinical services are provided by a master's level therapist. Care coordination is provided by a bachelor level individual who is helping with concrete needs, community needs, helping to connect them with resources. And then psychiatry is if a family is interested in being evaluated for medication, they would we would make a referral to our psychiatrist who would do an evaluation and determine if medication would be an appropriate route. And so an individual could be getting all three services, or they could be getting care coordination or clinical services. If they're receiving psychiatric care, they have to be involved in therapy.
Thank you for the clarity. Councilperson Smith?
Yes, thank you, Madam Chair. Hi, Gail. Thanks for the
Hi.
information. I have two questions. One, approximately, and you may have said this and I might have missed it, but how long does a kid, person stay in the program to move through successfully? And then my second question is, do you have a way of tracking, say 6, 8, 10, 12 months out to see how they're doing?
Absolutely. So there is no set length of treatment. So we could treat someone for 3 months. Someone could stay in our program for a year. The average length of stay is between 9 months to a year. We are constantly assessing. So every 3 months, we reassess the individual and the family to look at what the treatment goals were they accomplished, what is the individual's functioning, and are they ready for discharge? So it's the decision when they're done is made in conjunction with the individual and the family at
Great.
that time.
Great.
Are there any other questions? Okay. Gail, we would just like to thank you for the presentation tonight. This is such a great service to the city. This population is in need of services, and sometimes that language barrier prevents them from getting the help that they need. But the fact that your staff is bilingual, the fact that you do an aggressive outreach and referrals and stuff really is helping to empower this population to seek the services that they need. So for that, we do say thank you, and for partnering with the city. We're going to move on to the action item, which is related to the presentation.
I just had one more question. I'm sorry, I couldn't get to my raise my hand.
Sure, Councilperson Wiggins.
All right, thank you, Nicole. So one question. So how many families are typically served throughout the year?
So let me go back to that. For this fiscal year, we had, oh, it's on the top one. There were 153 open cases between both programs with 75 new referrals. Throughout the year, cases could be kind of opening and closing, and we could get some new ones in while others. So 153 over the fiscal year were served with 75 new families. So we have, just to clarify, we have 3 teams, three clinicians and 3 care coordinators that are going out, and they typically carry at any given time a caseload of about 20 to 25 families.
Any additional questions?
So thank you so much. I would appreciate the support. Mid-Fairfield appreciates the support of the city, and thank you for your kind words about our program.
Absolutely. So we will go on to our action item. It reads as follows. Authorize the Mayor Harry W. Railing to execute any and all agreements, documents, instruments, and amendments as may be necessary with Mid-Fairfield Child Guidance Center, Inc. for continued in-home mental health and family support services for public school children under the Community Service Department for the period July 1, 2024 to June 30th, 2025 in the amount of $200,000 account noted and $100,000 account noted. Is there a motion? Councilperson Smith. Okay, all in favor? Raise your hand. 1, 2, 3. We have 4. Any abstentions? And anyone against? 2 against. So we had 4, 4, and 2 against. Thank you. Oh, my favorite. Number 6. Can I get a motion to adjourn?
Motion to adjourn.
Thank you. Thank you so much, Barbara. Thank you guys. See you soon.
Thank you, everyone.
Good
Have a good
night.
night.